Hello, everyone. I was asked to be here today. I believe there's some concerns about supporting clinical staff through our member organisations just in these trying times with COVID and that. So I'm here to just talk about some strategies and stuff that we can encourage our staff to do to maintain their productivity and also their general health as well, as it's a stressful situation and can impact greatly on our home lives as well as our work lives. So what I'm talking about is self-care. So as managers of our staff, I believe it's important for us to encourage our staff to take steps to manage their self-care. Working as a clinician, we've done care plans for everyone else, and the nature of our job in caring for other people who are quite sick, we seem to forget ourselves, and we find ourselves getting burnt out and sick ourselves because we think of ourselves last, and it's always about the patient or client. So I just want to mention some resources that are available online. There's quite a good resource through Black Dog Institute. The title of it is Self-Care Planning for Health Workers. And that's really great. It's got some templates in there and some instructions on what it is to create a self-care plan and what are the things you should be looking out for. So encouraging your staff to take a look at these resources is a good first step, but just encouraging them that it's okay to, look out for yourself as well. Because sometimes when we try to take time out for ourselves, we usually have to take time away from our clients and we feel guilty about that. So we tend not to do it. Reinforce to your staff that it's one of the most important things they could be doing to maintain their productivity and also to get the best results for their clients. So one of the first things that you can do to identify some of the needs for yourself when creating your own self-care plan is creating a list. And it's just listing all the things that you choose to do that create a sense of well-being within yourself. So some of the areas you should be encouraging them to look at is the physical side of things, what makes you feel physically well, things that you choose to do. Also looking at your emotional, what things do you do that makes you feel emotionally well, positive. Sometimes it's about finding the right way to express how you're feeling at the time, maybe just talking to a friend or family, or even getting counselling or reaching out to AMSANT for supervision, just to be able to express the emotional drain that it's having on you and stuff like that. Encourage them to explore the spiritual side of themselves, whether, getting back to nature, praying, or, reconnecting with culture. They're all very important things, things that get left behind when we're very busy. And then also analysing, the positive sides of our professional life and what we're doing in that helps us maintain our professional work at a high level, and just really identifying what the positives are, what the negative things little habits we may have that take away from that. And then also reminding staff to, not to disconnect from their social contacts. It's very important to get support from your friends and family. And then it's also important to identify friends and family that may not be suitable to provide that support and may add extra stress to you outside of the workplace as well. yeah, it's about looking at the psychological part of yourself. So really this list is just a self-analytical thing that we go through to help ourselves identify what we need as an individual to maintain our best self and continue to work at best practice. So there's on this site on Black Dog Institute, they've got a couple of templates there, and it lists all the stuff that you can look at and has examples on there. It's a great resource that I'll always recommend it to anyone working in health. Yeah, I believe it's something that's overlooked, and I think it's the reason why a lot of our staff move on because they're overworked and they haven't had the time for themselves to heal themselves. I mean, the area we're working in can be very traumatic, especially for people that coming from outside of the environment, new to the Northern Territory and unfamiliar with remote areas and the community interactions within those small places, and dealing with the trauma that's already there, and just hearing the stories that, and witnessing some of those stories can be very traumatic to our clinicians. And so we need to support them, and we need to make sure that they are right. Because as a clinician, we tend to push all our stuff to the side so we can deal with what's going on in front of us. And then we never quite get back around to dealing with that stuff that concerns our own trauma or our own happiness. And then we get burnout. So yeah, there's a lot of other resources on the internet concerning self-care. As managers and as in the workplace, one of the best things we can do is just ask our staff, are you okay? And then also just try to be a bit flexible in the way we deal on a day-to-day basis with what's going on within the clinic. Encourage them, if they're feeling overwhelmed within the workplace, to take a walk. Take time, it can be 10 to 20 minute walk, can clear your head and help you come back and reset and face the day. But also always follow up with your staff, just to make sure that they're doing the little things that are available to them, and just encouragement. And as managers yourselves, please do a plan for yourself as well, because it's hard for us to look after our employees if we're not doing the same for ourselves. Okay, so not taking up too much of your time, but it's just, I think, one of the best ways to manage the current situation within our clinics is allowing our staff to have that time to create a care plan for themselves. We've all written hundreds for clients. Now it should just take an hour out of one day to write one for ourselves. All right, thanks guys.